So today we're going to talk about 3 specific treatment options that can help you stop smoking. Smoking has a lot of negative consequences. Cancer, lung disease, COPD is a big one, heart disease, stroke. Right now we're talking about 3 medication options that can help you stop smoking. First one I'll talk about is nicotine replacement therapy. This is where a lot of people start because they can get it over the counter. You're taking the substance of a cigarette and you're giving it to yourself in another way that doesn't have so many of those harmful things that smoking does. So you can take it as a lozenge, a gum, a little vape type nicotine device. There's patches, and people use different ones to get their effect. It can really cut back on some of the withdrawal that people feel when they stop smoking. It's usually fairly affordable compared to some other options, and it can be really helpful if you're going to be combining multiple modalities like a patch and gum or patch and lozenge to help you stop smoking. I would work with a medical provider to make sure we're doing that safely and under supervision. The second one we'll talk about is bupropion, which is also an antidepressant medication. This will be used when there's comorbidities or additional problems that we're trying to help at the same time. It's a really good medication for depression. So sometimes when someone's depressed and trying to stop smoking, this is a good option. It can also help with weight loss. It can also help with ADHD type symptoms. It is what we call psychoactive, something that's working on our brain, increasing norepinephrine and dopamine. It can be a really efficacious and helpful treatment to stop smoking. The third one is actually the most efficacious and the one that I recommend using the most often, especially if a few things haven't worked, is Chantix or varenicline, a partial agonist. So it occupies where the smoking is and it activates it partially. That really helps decrease people's cravings, decrease their withdrawal, and help them successfully quit smoking. Chantix has had a little bit more controversy over the years with some of the questions around how it can impact someone's depression, anxiety, mood, things like bipolar or suicidality. Chantix is safe in a lot of instances, but you would want to be working with a mental health provider or a medical doctor who's going to be evaluating and monitoring those risks appropriately and tailoring them to your solution. In summary, these are 3 medications that are very helpful for people to stop smoking, but sometimes we need to address some of the other problems or add things like behavioral therapies that can be really effective in helping you actually get to that place you want to have stopped smoking.